All right, let's dive right in. Today, we're going to pull back the curtain on the incredibly clever science of antiviral medications and find out how these drugs outsmart some of the most sophisticated hijackers on the entire planet, viruses.
So this is really the central question, isn't it? How in the world do you fight an enemy that's microscopic, that's stealthy, and that definitely doesn't play by the same rules as other germs? How do we even begin to fight back?
Well, to understand antivirals, you first have to see what makes viruses so unique. Think about it this way. Bacteria are like invaders. They show up, they set up shop in your body, and they can live on their own. We can hit them with antibiotics. But viruses? Oh, they're totally different. They're hijackers. They can't do anything without breaking into our own cells and taking over the machinery. And that's exactly why antibiotics are completely useless against them, and why we need a much, much sneakier strategy.
So here's our game plan. First, we're going to get to know our enemy, the basic anatomy of a virus. Then, we'll open up the playbook our drugs use to fight back, and we'll focus on two really brilliant strategies, the decoy and the direct block. And finally, we'll connect all the dots and see why this matters so much.
You know, to defeat a hijacker, you have to understand how they operate. Every single part of a virus is a potential vulnerability, a little weak spot that we can exploit.
Right at the very heart of the virus is its nucleic acid core. This is its blueprint. These are the instructions it uses to force our cells to make millions and millions of new copies of the virus. So if we can somehow corrupt this blueprint, we can stop the hijacking cold. And protecting that blueprint is something called the capsid. Just think of it like an armored getaway car. It's a really tough protein shell that keeps all that genetic code safe. So here's another strategy. What if we just prevent this getaway vehicle from ever being built correctly? No car, no escape.
And for many viruses, there's one more layer on the outside called the envelope. This thing is the virus's skeleton key. It's covered in these special proteins that basically trick our cells into letting it right in. So if we can block this key, if we can jam the lock, the virus is stuck outside, unable to even start its attack.
Okay, so now that we know the virus's weak points, let's take a look at our playbook. Turns out there are 5 main ways scientists have figured out how to exploit those vulnerabilities.
Now, each of these classes sabotages the virus in a really unique way. Some stop the virus from assembling its new parts, others block it from weaving its DNA into ours. But today, we're going to zoom in on just the first two, because honestly, they are some of the most ingenious tactics in all of medicine.
Let's start with the first strategy, and this one isn't about brute force at all. It's about pure deception. It's like a molecular Trojan horse, designed to trick the virus into destroying itself.
This is just brilliant. These drugs, they're fakes. They're molecular decoys that look almost identical to the real building blocks a virus needs to copy its blueprint. The virus, in its mad dash to replicate, greedily grabs this decoy, tries to plug it into the new DNA chain, and boom! The entire production line just grinds to a halt.
A classic example of this is a drug called Acyclovir. It is a master saboteur that we use against the viruses that cause herpes and shingles.
And here's the most amazing part. Acyclovir just floats around your body, totally harmless, until it finds a cell that's already been infected. Only then does a special viral enzyme flip a switch and activate the drug. The virus literally arms the weapon that's going to destroy it. It mistakes the now active drug for a real DNA building block, adds it to the chain, and that's it. No more blocks can be added. Mission accomplished.
So where do we use this drug? A really simple way to remember is the mnemonic HATS. H is for herpes, A is for acute infections, T is for topical or skin infections, and S is for shingles and chickenpox.
Of course, no drug is perfect. For acyclovir side effects, a helpful way to remember is KNN. The K stands for potential kidney toxicity, which is why staying hydrated on this drug is so important. And the 2 N's are for rare neurologic effects and the more common issue of nausea.
Now, acyclovir isn't the only decoy in the playbook. Another major player is a drug called Tenofovir. It uses the exact same core strategy, but it's deployed against 2 other really formidable viruses, HIV and hepatitis B. It's actually a cornerstone of modern treatment for both.
For Tenofovir side effects, you can just think KBB. K for kidney toxicity again, B for a potential loss in bone density over time, and the last B for belly issues, like nausea.
Okay, so that was the decoy strategy. But what if instead of trying to trick the virus, we just jam its most critical piece of equipment? Well, that brings us to our second strategy, the direct block.
These drugs are called NNRTIs. They don't mimic anything, they're not decoys. Instead, they find a crucial viral enzyme, this thing called reverse transcriptase, and they bind right to it. It's like jamming a wrench straight into the gears of the virus's replication factory. The machine is just physically blocked from doing its job.
And this tactic is absolutely vital in treating HIV. You see, HIV uses that reverse transcriptase enzyme to write its own genetic code directly into the DNA of our immune cells. So by jamming that enzyme, NNRTIs stop the hijacking before it can permanently take over our cells.
As for side effects with these, a good mnemonic is SHC. S is for skin rashes, which can sometimes be pretty severe. H stands for hepatotoxicity, which is potential liver damage. And C is for central nervous system issues, like dizziness or even really vivid dreams.
So we've seen these two incredibly smart strategies, trickery and sabotage. What's the big picture here? Why is this targeted approach so important?
It really comes down to this. Antivirals are the absolute epitome of precision medicine. They aren't carpet bombs. They are highly specific, intelligently designed tools that use an intimate knowledge of the enemy to turn the virus's own biology into its greatest weakness.
But this battle, it's a constant arms race. Viruses are relentlessly evolving, always changing their tactics to try and get around our drugs. And that leaves us with a really critical question. As the viral playbook keeps changing, is our own playbook evolving fast enough to stay one step ahead?